Hello, Professor Montalescot. Can you tell us why heart failure remains a major public health concern in 2021? And what is the relationship between myocardial infarction and heart failure?
So heart failure is a major concern because in 1,000 individuals, you have roughly 10 of them with heart failure. So you see the prevalence is quite elevated. And now if you look at specific groups of patients exposed to heart failure, it may be much higher. For example, in the elderly, it's 100 patients in 1,000 individuals with heart failure. So it's a real concern. It's a source of hospitalization, and clearly we need good treatment to control heart failure in these patients. And the first cause of heart failure is coronary disease. And of course, when we say coronary disease, it's mostly acute myocardial infarction, first cause of heart failure.
Today, what is the standard of care for acute myocardial infarction and post-MI treatment? And did primary PCI solve the problem, or is there still an unmet need?
We have to dissociate treatment for acute myocardial infarction and treatment for heart failure. If you present with myocardial infarction acutely, you will need revascularization, and it's going to improve your prognosis very much. We know that revascularization within the first 12 hours, if possible 6 hours, it's going to reduce deaths considerably. Once you have done this, there are drugs for the ischemic disease, and we use these drugs, of course. On the side of heart failure, it's mostly drug treatment, and we have lots of drugs for heart failure these days. ACE inhibitors, for example, beta blockers are also drugs of heart failure. Aldosterone antagonist is another class of drugs useful in heart failure. Digoxin, and even diabetic drugs now are effective in heart failure, like gliflozin.
What about the Quorum study? Why is it an important study?
I think it's a very important study because, as always, when you have a first-in-class drug, you need to look at the results very precisely, and you are eager to see the results because it may be a new class of drugs to control heart failure. And this is the case here for firibastat, which is one of these drugs. It's a brain aminopeptidase A inhibitor, first in class, and it's going to be tested now in this kind of patient. Acute myocardial infarction, large myocardial infarction, all of them are anterior myocardial infarction, and they are exposed to have heart failure because it is a large myocardial infarction. So we are testing this new drug against what is the standard of care, which is ACE inhibitors. And we test 2 doses because it is a phase 2 study, and we increase the dose at 2 weeks, after 2 weeks of treatment. And we expect to see a benefit against what is the standard of care and what has been the standard of care for years. If you remember well, ACE inhibitors have been tested in acute MI a long time ago, before revascularization, in a different situation to the situation that we have now. So it's a brand new picture that we will get with this study in 300 patients. It's randomized, it's double-blind, it's international, and we will have a primary objective, which is a very important objective because it is related to the prognosis of patients. We are going to look at the evolution of ejection fraction in the first 3 months after MI. And if we see a benefit on ejection fraction in these 300 patients with the new drug versus the old one, this is not placebo, this is a very active drug in this setting. If we see a benefit, that will be a breakthrough in the treatment of this kind of patient.